Hi, thank you so much for joining us today. We're here with Dr. Nancy Welch, Acting Director of the Western Tidewater Health District.
Good to be
Dr.
here.
Welch, thank you again for joining us this morning.
Good to be here.
Now we're going to talk about something very timely today, and that is pertussis, or as most people know it as whooping cough.
Yes.
And I understand that we've really seen an increase in numbers here recently with that. Let's talk about that.
Yeah, we absolutely have. Since 2007, the number of cases of pertussis or whooping cough has doubled. When you look at the trend lines, once the pertussis vaccine came out for children, you had a dramatic drop. But now over time, as there's a lot of controversy in different populations who don't want to take the vaccine, and as that has been occurring, we have seen an upward trend now. So we're moving again to an increased number. And the people who are most impacted with regards to complications, hospitalization, and deaths, in fact, 90% of the deaths are in this population, is the children less than a year of age.
What exactly is pertussis?
Whooping cough, the name says it all pretty much. Starts out with just sort of a cold, kind of minor symptoms, and then it moves to the next phase, which is just a severe whooping cough. The child has trouble getting their breath. They can turn blue, cyanotic, because they can't get their breath, they can't get the oxygen. Very, very scary experience for both child and parent.
I can imagine. So is it same symptoms throughout, regardless of the age of the person affected?
Very good question. Very good question. That's the symptoms primarily with your younger children, meaning especially less than a year of age, because 60% of them may ultimately end up in the hospital. They can be so severe. But even in your younger children, they also get that severe whooping cough. Interestingly enough, and I don't have an explanation for this, only 1 out of maybe 5 or 6 adults who actually has the germ, capable of spreading the germ, has the disease, isn't sick. So only 1 out of 5 or 6 of them will actually get symptoms. And even then, you just don't think of whooping cough in the adults as we should. We're certainly educating physicians to think of it now and get the appropriate test. So most of the time they're diagnosed with bronchitis and not whooping cough. But in the interim period, they're spreading the disease.
So they are, I guess, essentially the carriers then, so to speak?
Yeah, they're sort of what we'd call the spreaders. It's kind of a reverse of what you see with flu. With flu, the children are more likely to be the spreaders who give it to the adults, only they don't get as sick with it as the adults. So we really push for the adults to get the flu vaccine to protect them. But in this case, it's the adults who are the spreaders who are giving it to the children who really get sick.
So in terms of how is it actually spread? I know it's so important for, keeping our hands washed and that type of thing, but I guess with pertussis, that doesn't matter as far as with the hands and so forth.
Well, it does matter. Hand washing always does matter. Certainly being in public health, I'd never say hand washing never matters. Never a quote from me. But hand washing does matter, and it matters because it's spread by respiratory droplets.
Respiratory, okay.
And we don't realize sometimes how many times we might do a little wipe and we don't wash our hands. Or then we touch a pencil and give it to somebody, or we touch a doorknob, and so we may have that germ present on our hands. So hand washing is absolutely, absolutely key. But it is spread by those droplets, the respiratory, so even if they're not having the symptoms of coughing, they still can have it in the droplets and can spread it just by a simple little cough that we think is benign and not really a whooping cough.
So basically then, how soon after exposure do these symptoms normally appear within the population?
Well, they can vary, but they're usually going to appear at least within a week, 4 or 5 days. But again, the initial symptoms are very mild, and that can go on for 10 days or so, and then they get into the really severe whooping cough, and that can go on for weeks.
So in terms of the importance of getting the vaccines then, what population is the most, I guess, target area to receive the vaccine?
Well, there are a couple target areas. One is you absolutely want to have the children protected. And they have routine immunizations. Most parents who have children remember going to the doctor and getting, some call it the 3-in-1 shot or the DTaP, or there are different names that they give it. But it's the diphtheria, tetanus, and pertussis, and it now has that little A in front of it, which stands for acellular. And since that came out in, I suppose, the I'm not sure, not too long ago actually, since they created this different format of the acellular, it's much, much safer, and we can give it to children and adults, anyone over 7. It used to be we couldn't do that, but you want to definitely have the young children get their routine immunizations, and there's several that they get, so that they get boosters. The truth of the matter is that even after they've had the 3rd basic shot, 2, 4, 6 months of age, this vaccine is not as effective as our other vaccines, in that still only maybe 85 to 88% of the children will be fully protected, even after having received, as they should have, the basic immunizations, the first 3 shots. And then they have boosters, and they have boosters before school. Because we are seeing this resurgence now, research is showing us that there is another population that we want to target as much as anything else to protect the younger children. Because the younger children are the ones who get the complications. California just had a massive whooping cough outbreak. They had 10 children die from the disease, and you can't take that back. So we now know that this vaccine is also very effective and very safe for adults over 19, for even pregnant women, and that's just come out this past summer. That it used to be that we wanted to focus on the woman after she gave birth, so that anyone who's around a child, that's sort of the cocooning concept, anyone who's around a child is protected from giving the child the disease. It's not so much to protect that adult, because as I said, most of them have no symptoms. They don't know they have it, but they're spreading it. But now we know that the pregnant individual can also receive it anytime after 20 weeks gestation. And of course, all the grandparents. And you know, you go into a grocery store, how many times have you seen a little child in the grocery store, and you go over and say how cute, you talk with the child. It happens all the time. So even without having grandchildren or young children, you're exposed very often to these children. And none of us want to be a spreader of this very severe illness to any of these young children. So a big emphasis now for protecting the young child is to have pretty much anyone over 19 to receive the Tdap vaccine, and for pregnant women to receive it after 20 weeks gestation. And you know, as I said, for the flu shot, we ask adults to get it to protect themselves. And adults sometimes can deny they're ever going to get it, or they say, I'm going to tough it out. So the take rate is not as high as we'd like it. But on Tdap, it's to protect the child. So it's a total paradigm shift. I don't know any adult who wouldn't walk through fire to protect a child. And I can absolutely promise that this Tdap shot hurts less and is just as effective.
Now, one question that I had too was, as it relates to the Tdap shot, is that something that is just a one-time occurrence, so to speak, a one-time shot or whatever, and then you're protected, or
that's a very good
required
question
as well?
And the truth of the matter is that research is continuing on that. When the shot came out for children, for example, we didn't know about giving boosters later on, but then as they did research and saw that the protection waned over time, then we brought in boosters. My guess is that as research goes on this, that may be the case, potentially, but it's all going to be based on research and what the findings show in terms of how long your protection lasts. And there are different, what we call simulation models, where people are looking at simulation models and actually trying to address this exact question to see what will keep that pertussis down the most. One of the most intriguing simulation models was if you looked at giving the vaccine to anyone who's around a child, the basic cocooning, as we've mentioned, but then also to any adult at age 40. And that was a very intriguing simulation model that seemed to show over time that would have the greatest impact. But that's simply a one-time study. We're going to have to see what further research goes. But here in Suffolk, as throughout the state, not just here in Suffolk, but we are making every effort, going to children's centers, going to daycare centers. We're working with the city right now to try to provide immunizations to their employees, especially Parks and Rec, people who work with children, talking with the schools about going to their schools to provide immunizations for not just teachers, but also the custodial staff also has contact. Anyone who has contact have gone to Salvation Army, where you're dealing with people who have no other resources. And we've had pertussis actually in a school in Isle of Wight and in Suffolk. We all work together in the district, and so they went out and helped to provide protection for the faculty there as well.
Now, are there any risks of, if you've gotten the Tdap vaccine, of getting it again, say a few years later, just to be on the safe side, as some people like to say, or?
Right, there should be no risk to that. In fact, initially when the Tdap vaccine came out, they said, well, if you had a tetanus shot 2 years ago, you don't want to have this again. But now the research says it doesn't make a difference, so they've totally removed that kind of a time frame limitation. So this is ongoing research. Just as I said, the information that pregnant women can now receive, it literally did not come out until the end of this past summer. So research is ongoing and is very robust. And as new information comes out, we're certainly going to be sharing it with the public.
Well, and that's a great thing, too, about the Tdap vaccine in and of itself, is not only are you protecting yourself from tetanus, or especially with summer weather coming, and, you know, folks with a lot of outdoor activities and so forth, get it now, and that way we're protected, of course, protecting our young ones, and then that dual protection as well. So,
how many of us remember to get that tetanus booster?
Not until you step on that nail out doing yard work or
not until you have a
whatever.
problem. But now, and we're working with the emergency room, when you have that situation occur and you are going to your doctor or the emergency room, instead of just getting the tetanus, get the Tdap. It works against the tetanus and also against the pertussis.
Now, as it relates to the actual pertussis, to the disease itself, what type of treatment is available for that?
You've done your homework here. That's very good. There are two things that are involved when we talk about treatment. One is treatment of the disease, and the other is preventive treatment or prophylaxis. And treatment of the disease, again, in both cases, actually, is a simple antibiotic. It's very easy to give. There are a couple choices. It's up to the physician to which one they want to choose. But you certainly want to be sure that the person who has the disease is adequately treated with the antibiotic. But our epidemiologists, when it is a reportable disease, and it's a reportable disease because it's so easily spread and contagious. So a part of what our epidemiologist does is does an intensive investigation to see who has been in close enough contact beyond the obvious, the household, but also at school or other environments, so that we would recommend prophylactic or preventive treatment for them, and that can keep them from getting the disease.
Okay. Dr. Welch, we're going to take just a very quick break, and we'll be back in just a moment to talk about where folks can get the vaccines and possibly answer some additional questions as well.
Thank you very much.
Hi, welcome back. We're talking with Dr. Nancy Welch about pertussis or whooping cough. And Dr. Welch, right before the break, we had talked about where we could get these vaccines and so forth. And let's go ahead and share a little bit about that now.
It can be, actually you can get the vaccine at any of the health departments, and you don't have to get it at the one simply in your residence. You may, if you work in Virginia Beach or you work in Isle of Wight, no matter, you can get it at any of the health departments. The same criteria hold for all of the health departments. So I don't have the schedules, obviously, for all of the health departments in the eastern region, but I believe you have a number up on your screen for the Suffolk Health Department, and you don't have to make appointments, it's walk-in, and it's Monday through Thursday, 1 to 3:30 in the afternoons, and no appointment is needed. We also would encourage, as I said, we're working with schools, we're working with the city, we're working with daycare centers, Salvation Army, trying to provide this vaccine to any place where they have the contact with schools. So if you happen to be in a situation where your job or the office where you work has a good number of school contact, then you can certainly call that number, and we'll be happy to come to you and see how we can provide the vaccine.
Now, when we talk about the vaccine, I believe there are two different types, the Tdap, and I was trying the other initial, or?
Well, there are ones for children.
Okay.
That's a different initial.
Okay.
Okay. And one is a difference in terms of what's capitalized and what comes first. But the nurses have both of them, so that's not a problem. You just come to the walk-in clinic and You don't need, all you have to do is say, I want the pertussis or the Tdap or the tetanus and pertussis that's combined, and they have all of the vaccines right there.
So again, when we talk about the whole cocooning and so forth, as far as making sure that those that are around our youngest, most vulnerable citizens are covered, I can't think of a greater gift that a grandparent could give than knowing that they got their Tdap vaccine to keep that precious little one safe.
Absolutely, and you know, that's probably the greatest selling point. Tdap is a much easier sell than flu, as I said, because people tend to be stoic with regards to themselves, but nobody wants to be stoic in terms of protecting the children. So it's a very, very easy sale. You take this shot and you're protecting any child with whom you may come into contact at a grocery store or your own grandchild. So that's really the nice thing about talking about
It truly
Tdap.
is. And Dr. Welch, are there any segments of our population that should not receive the vaccine?
Actually, this is a very safe vaccine with that acellular component. So pretty much the only population is if someone has a history of having had a really bad reaction to a Tdap type vaccine in the past. And so this information can be provided to the nurse when they come, but it is really one of our safer vaccines.
One of the things I found rather interesting as well was in terms of putting the age as far as with some of our seniors, 65 and older. Is there a particular reason why that segment is more necessary to get the Tdap or not?
Well, this may be age discrimination, but it's probably thinking that there are more of them who have grandchildren.
Okay.
And in today's society, a lot of grandparents are the main care providers. With so many of the parents working, a lot of the grandparents are taking care of their grandchildren during the day. So it's really, as much as anything else, a recognition of the role that the grandparent has in their interaction and their frequency of visiting, of contact with the young child.
So as a grandmother of a 6-month-old, I don't think the contact can be often enough. when we
You don't
get
look
down
like
to
a grandmother,
it,
I'll
that's right.
tell you.
But it's one of those things, as I'd mentioned again, it's, you know, one of the most important things we can do to protect those that we
Absolutely.
love. It truly is.
Absolutely.
Now, as it relates to, I know that there have been some cases in Isle of Wight. Any cases here in Suffolk, and what type of vaccines have you already provided? I know you've got some statistics as well.
Right. We've not had any cases here in Suffolk. As I said, we've had it in Isle of Wight. The reality is actually in the eastern region, and that includes a large area, Western Tidewater, Chesapeake, Virginia Beach, Norfolk, so it includes Hampton, Newport News. We average about 42 cases of pertussis a year, so we have a pretty large amount of cases. What's of concern to me is that my guess is that a fair number of cases of pertussis aren't diagnosed, not only in children, but as I said before, you're not getting them diagnosed in adults, so diagnosed as bronchitis as they go around and spread. So we are pushing the vaccine, and as I said, we've already scheduled for a number of daycare centers. We've gone to Salvation Army. We've given literally hundreds of vaccines. We would like to give thousands of vaccines, so we're ordering it every day to be sure that we have enough here, enough supply. So if someone has an interest or need in their particular place of work or place of employment, definitely contact us. For public health, house calls are not gone. But by house calls, I mean more probably business calls, school calls.
Right.
But we do a lot within the community. That's really our focus, is within the community.
And you all do such an amazing job. And I know we've talked about this in the past, where when you think about it as far as public health, there's no truer name than that.
That's right.
With what you all do provide to our community.
That's right. Well, as I said, I like to remind people that every single citizen of the city of Suffolk is a patient of ours. We have the largest practice of any healthcare provider. The type of care that we provide is primarily preventive. So we almost take it as a personal insult if we have a disease that we could have prevented. So we want to be able to protect the public.
Well, Dr. Welch, again, thank you so much for sharing this valuable information with us and for your time this morning. And we look forward to coming back to you in the future to talk about some other interests of interest to our community as well. So again, we thank you so much for joining us. And here's to your health.
Thank you very much.